Welcome to the podcast entitled Health and Wellness Briefs, Tactics for a Better You. I'm Dr. Bernadette Melnyk, Vice President for Health Promotion and Chief Wellness Officer for The Ohio State University. This podcast series is brought to you by my CWO office and wonderful Buckeye Wellness team in order to provide you with evidence-based micro-learning modules to optimize your health and well-being. Our podcasts start by taking a dose of vitamin G. Given that vitamin G, or gratitude, is one of the simplest research-based strategies to improve mood, sleep, and optimism, and reduce stress and blood pressure, please take a few seconds now to think about who or what you're grateful for today. Give a dose of vitamin G to someone today for even more benefit. Well, today I'm doing a special podcast for all nurses across the globe. I want to give a special shout out, though, for our Buckeye nurses who do an absolutely fantastic job of delivering evidence-based care in such a wonderful, caring, warm way. They are key to ensuring our healthcare systems, quality, safety, and patient outcomes. I want to start the podcast today by giving each and every one of you a huge dose of vitamin G. As a nurse practitioner, a researcher, and expert in evidence-based practice and mental health, I really value every nurse that shows up every day to care for their patients and to care for each other. Today, though, I really want to talk about taking the time to prioritize your own self-care. When we get on an airplane and the oxygen masks drop, we are told, put them on ourselves first before we put them on our children. Nurses are great care providers, leaders, managers, educators, researchers, evidence-based practice mentors. But we also have so many other responsibilities. We give and give to everybody else, but we often do not prioritize our own self-care. Self-care is not a nicety. It's a necessity, because if we don't take good self-care, we cannot do a good job at taking care of others. And I know what you're probably thinking. Bern, that's easy for you to say, but you don't understand the demands in my life. You don't understand. I'm taking care of children. I'm taking care of an elderly parent. You might be working 2 jobs. Believe me, I can say, I know how you feel because I have been there as well. But if we don't prioritize just a little bit of time to do what brings us joy or to engage in healthy lifestyle behaviors, 10 or 15 years from now, we are going to be struggling with our physical or our mental health. Maybe today you're feeling burnt out. You're feeling stressed. You're feeling anxious, maybe a little depressed. It's okay to feel that way some days, but we need to face our true story if we're really struggling with those things and get help. Getting help is not a weakness. Facing our true story is part of getting help. It again, it's a strength to recognize when we need help, not a weakness. But there are many things we can do that are brief to help us deal with stress and burnout, anxiety, and depression. Sometimes we forget just a few very big, deep breaths throughout the day using the 4-7-8 method can really help to decrease stress, bring down our blood pressure a little bit. And if you worry a lot about the future or you feel guilty a lot about the past, I want to encourage you when you start to worry or feel guilty to just focus on something in your present moment. Turn your head slowly to the left, move it slowly to the right. Find 5 things you can see, 4 things you can hear, 3 things you can feel. That mindfulness activity gets you to really break this wicked cycle of worry or guilt. I also want to encourage you the next time you begin to feel yourself being stressed, depressed, or anxious, to stop and say to yourself, what was just going through my mind? Is it helpful to be thinking these thoughts? Is it true? Do I have the evidence to back it up? Because a lot of times the answer is no. So if we can get in the habit of practicing for the next 66 days, how to catch, check, and change our thinking, we will feel so much better and have less stress. So, just as a reminder, if we want to cut our risk of chronic disease by 80%, if we can just take a few 10-minute breaks during the day, take a walk, do some jumping jacks, turn on music we love and dance to get in 30 minutes of physical activity, to eat 5 fruits and veggies a day, not smoke, and limit it to just 1 standard drink a day. Then everybody asks me, how big can that drink be? And I tell people, not the size of the alcoholic beverages we get in Vegas. Lastly, 7 hours minimum of sleep a night. and daily practice of some stress reduction techniques, whatever works for you, deep breathing, mindfulness, cognitive behavioral skills, just get in the habit, even if it's a couple minutes a day, to practice those helpful stress reduction strategies. Finally, I need to ask you this question, as I ask everybody. If I could be your fairy god person in the next 2, 5, 7 years, what are you going to do if you know you cannot fail? What are you going to do if there is no failure? That is cultivating, getting back to dreaming big again. So many nurses lost their dreams, got burnt out through the pandemic. And research shows the key to happiness, according to the Blue Zones, is the ability to dream big. It's your purpose and your passion. And if you're aligned with your dreams, your purpose, and passions, you'll never feel like you work a day in your life. So a Nurses Week, again, I want to give the biggest dose of vitamin G. Thank you for all you do every single day. And never forget how much you matter. You matter so much, and you're so valued. I want to encourage you, take good self-care. Prioritize your self-care. Again, happy Nurses Week, and keep dreaming, discovering, and delivering. Thank you all for listening to Health and Wellness Briefs. Tune in to my other CWO podcasts in this series to learn more evidence-based tips for a healthier, happier, and better you.